being recorded. We are your moderators, Eileen Morales and Connie Jacobs. I'm Connie. I'm a bilateral cochlear implantee. I was implanted with my first one 17 years ago this month, and my second one 15 and a half years ago. Eileen, would you like to give?
Eileen, yes, I'm here. I'm Eileen Morales. I'm bilateral with Advanced Bionics. I was implanted in 2020, first in January, and then it was so awesome that I did my second year in December. So I just love it.
This talk is part of an ongoing series for parents, adults with hearing loss, family members, and others. As a member of the ACI Alliance Advocacy Network, ICANN, or Cochlear Implant Consumer Advocacy Network, we hope you will learn from this session and consider getting involved in the work of the ACI Alliance. Next slide, please.
Ready? First, let's review the technology and go over the Zoom settings that will help you. To access closed captioning, please click on the live transcript box on your screen, usually at the bottom. Click Enable Live Captioning. If there are any concerns, please send a message to the hosts via the chat box that's on the bottom of your screen. To ask a question, please use the Q&A box.
Next slide, please. American Cochlear Implant Alliance is a unique organization focused on CI across the care continuum. We were founded because it was felt the cochlear implants fall through the cracks at other hearing health organizations, and we wanted to focus attention on improving access to CIs. The mission of ACI is to support research, advance awareness, and advocacy.
Go ahead. CI can. The CI Consumer Advocacy Network is for adult consumers and family members of recipients, including parents, aimed at enhancing and enlarging the broader advocacy efforts with firsthand knowledge of cochlear implants. Personal stories make a difference in impacting decision makers and adds credibility in our contacts with state and federal representatives on key issues. If you're interested in learning more, please let us know in the chat box, and ACI Alliance staff will follow up later.
We also wanted to share a few of the ACI Alliance website resources that are available on, next slide.
And now we are delighted to introduce our featured speaker today, Meredith Holcomb AuD, CCCA, is a practicing cochlear implant audiologist with 16 years of experience. She is an associate professor and director of the Hearing Implant Program at the University of Miami Ear Institute. She received her doctorate of audiology from the University of North Carolina at Chapel Hill, and she spent the first 13 years of her career at the Medical University of South Carolina as clinical director of their cochlear implant program. She is the immediate past chair of the American Cochlear Implant Alliance Board of Directors and will complete her 6-year board term next month. She serves on the Joint Committee for Infant Hearing, the Audiology Advisory Council for Advanced Bionics, NADEL, and Hemedina. She is a faculty member of the Institute for Cochlear Implant Training Advanced Audiology course and serves as a consultant for Cochlear Corporation and Audiology Online. Lastly, she is PI for 2 research grants with Cochlear. After the presentation, go ahead. Next.
Thank you all for that lovely introduction. And Eileen and Connie, it sounds like you two are super users with your cochlear implants. You probably remember the days a while back when implant technology was much more simple than it is today. And with all of those positive changes we have seen with the technology, it makes the activation and the whole process a little bit more detailed than it was probably when either of you received your first cochlear implant. So I'm sure you guys are making use of all of the new tools that the companies have out there. I want to thank American Cochlear Implant Alliance for allowing me to come back and do another Tuesday talk. I really love speaking to potential patients and cochlear implant users and families, of course, as well. So today they asked me to talk about what happens at the cochlear implant evaluation. So I'm going to give one big disclaimer. I do not have a cochlear implant, right? And so while I can definitely give you my experience and my expertise as a cochlear implant audiologist, I actually don't know what a cochlear implant really sounds like. And so I do like to mention that in here. Cochlear Implant Experiences is a Facebook group that I love watching. I learn so much from my patients and from comments and questions that many of you have posted in that Facebook group. It helps me shape my practice. It helps me think about tools and ways to better improve the CI activation appointment. One person just posted something the other day on there, and it said, describing what a cochlear implant sounds like is no different than trying to explain the color blue for someone who's never seen the color blue. So I thought about that a lot while putting this presentation together. You know, I think most of us go into the activation day super excited. We come in with our families, with maybe video equipment, cameras, cell phones, so that we can FaceTime loved ones in for this appointment. And no matter how much counseling patients have received or families have received prior to this appointment, the expectation almost always is this: I'm going to hear voices. I'm going to have great speech understanding the first day. This is going to be the best day. I'm going to be so excited when I leave. More times than not, this is sometimes what I get in my appointments. It's not that patients are necessarily upset, but they are underwhelmed many times the day of the activation. I also saw someone from Cochlear Implant Experiences post today that they had just had their activation yesterday, and that no matter how much they had been appropriately counseled beforehand, the patient said he still went in really hoping that he would understand speech very well on the first day. And of course, that wasn't necessarily the case. You know, I think our goals as audiologists oftentimes are different than the goals of the patient or the family. The two main goals that I typically have for activation is that the patient leaves hearing more than when they entered the appointment. So I have hearing underlined and I have it in bold because hearing is not speech understanding, right? So many times patients will leave hearing my voice or hearing tapping on the keyboard, or maybe they will hear the air condition. They may not always understand what I'm saying or discriminate that the air condition is different from the keyboard tapping. But regardless, leaving that activation with tools that they didn't have coming in, that's a success from an audiology standpoint. The other thing is I keep it very simple on the first day. I just want the family and patient to understand how to change the battery and how to place the device appropriately on your head or your family member's head. We come now with these huge suitcases and backpacks that we overwhelm you with on the first day. And some clinics may go over all of that equipment. We have found at the University of Miami that going over too much, there's not a good retention, right? And so what that means is even me as a patient, I had knee surgery several years ago. I tore my ACL, and they went over all of these things with my mom and I about, my brace that I had and the crutches and this water machine that I had to use every day. And we couldn't remember everything. So mom ended up having to call the nurse back the next day after we were not so overwhelmed to get more of that information. So keeping it simple on the first day really it manages your stress well, and allows us to really focus the time on you and your family and your experience. Now, I have this cute picture here because sometimes we have to be creative about how we make sure that patients know how to put the device on their head. This is a 92-year-old woman that I worked with when I was in Charleston. And she actually came in at her follow-up appointment, the activation appointment. I showed her how to do it. I think I assumed that she could do it on her own every time. And, for someone who is quite a bit older, sometimes that movement just of putting it back on your head, it can be a little bit challenging. And she came in with this blue spot on her head. And I said, Miss So-and-so, what in the world is going on? And she just laughed. She said, well, my husband and I decided to paint the area of my hair blue so that he could put it on for me because I was having trouble finding the magnet spot. So, this was my fault for not really making sure that the patient truly could do this by herself on the first day, but she managed to find some ways to make this a easy situation for her. So what happens that first day when you come in? Many of you have been through this process. Some of you have not yet. So one of the first things that we do as audiologists is to look at your incision site and determine the magnet strength. We talk about realistic expectations for the appointment, trying to remind you what we have counseled on prior to that day. And then we program the cochlear implants. We counsel on the basics of the CI equipment. And then we review your follow-up schedule and send you home. So this seems pretty simple, right? But as most of us know, it's not quite that simple, which is why we tend to have anywhere from 1 hour to 2 hours blocked for the time of you to have your initial activation. We're really fortunate at the University of Miami. We have 2 hours for all of our appointments. And most of the time we fill up every second of that 2-hour appointment because each of these steps is a little more involved than just the simplistic way that I listed it here. So when we talk about magnet strength, one of the biggest things is we're trying to make sure that the magnet's strong enough to stay on when performing daily activities. So for children and adults, that looks a little bit different. But regardless, it should not be so strong that, you're in a handstand or you're breakdancing, running, even jumping a lot, or gymnastics for kids. It should come off in those situations. Oftentimes we'll have patients and sometimes more parents want us to increase the magnet strength because let's use gymnastics for an example. It's coming off and it's frustrating. And here are some pictures of why we don't want it to be too strong. And this is from a recent publication. You can see some red marks on the head. You can even see where the skin has started to wear down. This is not good. If you get an infection, which can happen with a strong magnet, you could end up in the hospital for IV antibiotics and likely would need to not wear the device for several weeks or a month, sometimes even longer. I've also seen the device have to be taken out so that that area will heal for 6 months or so, and then the cochlear implant put back in. So there is a method to our madness. We are not trying to be restrictive of your activities by making sure the magnet's not too strong, but we're just trying to be safe about it. We talk about realistic expectations for the day, but we also want to go ahead and start talking about your expectations and what you want to get with this cochlear implant and really start managing those expectations. I use this client-oriented scale of improvement because it's a great way of acknowledging that there's specific needs for each patient, but it doesn't mean that it's a realistic goal. So for example, a realistic goal may be, I would like to be able to have an easier conversation with my spouse when we sit down at the dinner table at home. That's a realistic expectation. What may not be a realistic expectation is I'm a bartender at Chili's and I want to be able to understand my clients at the bar, even when I'm turned around making drinks for other clients. That's probably not realistic because of the amount of noise. You're not looking at the person. There's a lot of competing noise going on. So talking through those things can really, I think, temper the way that the rest of the appointment will go and the process of the cochlear implant journey. Overall, the number one patient goal for children and for adults is to improve hearing and speech understanding in quiet and in noise. And this is actually the same number one patient goal that we see for folks who are trying to look at getting hearing aids. So overall, for hearing technology, most patients want to be able to improve in these situations. Cochlear implants are wonderful devices. They give great sound awareness and detection. 20 to 30 decibels, though, is still what's considered a borderline normal hearing range. So I have a normal hearing range. I'm still going to hear better than someone with a cochlear implant. But a cochlear implant patient is going to hear much better than someone who has significant hearing loss and is not benefiting from hearing aids. But there's still, limitations to what happens when you have a borderline hearing loss. When noise gets excessively loud, it's going to be harder to understand people. Multiple talkers in large groups will still be difficult, not impossible, but you have to figure out ways to manage those situations. Telephone and TV are improved, and music appreciation certainly takes time, but can be improved as well. So usually on the first day, one of the first things patients will say is, this doesn't sound natural. This sounds robotic. Why does it sound like this? And so, I put together just a few things for pre-implantation and post-implantation, after surgery. Some things that are coming into play or variables about why the cochlear implant may sound not natural. What we typically see is that everybody's hearing history is different. Everyone's etiology or reason that they have hearing loss is different. Their hearing aid use is different. The amount of time that they've had hearing loss may be different, and their expectations are often different. And then post-implantation, there's a lot of things that we can control for, like fully inserting the electrode array, making sure the electrode is placed in the right place, consistent device use, which I'll mention that again later. But other things that sometimes we can't control are how much noise you're going to be in when you're using the device, what your cognition level is, how that's going to play into your speech understanding. Something we can try to control, though, is your programming parameters. But there's a big caveat to this. Programming the cochlear implant is not always the answer. We have so many tools as audiologists to try to help you hear best with your implant. But we also have a lot of restrictions based on the anatomy, and we can't necessarily overcome what the brain is going to do with that sound. Here's another way to think about why the cochlear implant always does not sound natural. You can see there, it looks like a piano, so low pitch to high pitch. And then you can see on the picture, the high pitches are at the base of the cochlea, and the low pitches are at the apex of the cochlea, okay? When you put a cochlear implant in, the cochlear implant is coming in this way, and it's trying to wrap up around the turns of the cochlea. But what happens often is the cochlear implant is just not as long as the entire cochlea. So the lower pitches of your natural hearing ear does not necessarily line up with the lower pitches of where the cochlear implant is trying to make sound. So that's what we call a frequency mismatch. So we have a lot of more knowledge than we used to about programming implants, and a lot of tools that audiologists are trying to use to overcome some of these frequency mismatches. But it takes a while for us to really fine tune this and for your brain to adapt to listening in a manner that's very different from the way the ear is structurally made. So I mentioned earlier the way that cochlear implant works, which I think most of you know this, the sound's going to come in from the outside and go all the way down into that inner ear, which looks just like the picture we just had. And so what we're doing with a cochlear implant surgery, we are providing sound to an ear that is not performing very well. So it's almost like a prosthesis, right? It's like we're giving sound to this ear, but it's not natural. It's electric. And so it takes a little while for the brain to learn to listen with electricity. What we don't have control of is how the brain is going to respond to the cochlear implant. So many times patients will come see me and they'll say, well, I'm so frustrated, it doesn't sound right, and they want me to make all of these changes. And on initial activation, most of you will say, this doesn't sound very good, can't you make it sound natural? And there's only so much we can do on that first day because the brain really has to take over and get used to this new way of listening. So patience is really a virtue with this process. So when we're doing the programming, there's lots of different steps that we'll take in the programming. I like to try and turn my computer around and walk these patients through some of these steps so that you can be involved and can recognize some things on the screen when we're measuring levels. You can ask your audiologist if you can, look at the screen and maybe get a sense for how things are going. One of the first things we do is we'll do a test. It's called Impedance Check, and it's looking at the status of each of your electrode contacts that are inside the cochlear implant. And what we're looking for is we're making sure that the current flow is in the tissue and the fluid of the cochlea. So I have screenshots of all three companies here, and really what you see is a fairly flat line with all three companies. That's what you want to see. If you start seeing something where it looks like a, jigsaw, a jigsaw, is that what I'm trying to say? Or if you see things that are kind of bouncing up and down, it may indicate that there are some abnormal current flow going on within the cochlea and the cochlear implant. The other thing that we look at, and maybe this isn't on the first day, but we'll talk about it the first day, we are able to see how many hours you're wearing the device. It's called data logging. And we're also able to see what sort of environments you're in. This is amazingly helpful. Back when our moderators were implanted, this was not something that we had at our fingertips as audiologists. So we really had to rely on, patients saying, I'm wearing it 5 hours a day, 10 hours a day. Oh yes, I'm around speech all the time. Or, different things that we were having to ask questions about and asking parents about how the children were using it. Now we have tools that will tell us how many hours a day the device is turned on, how many hours a day it's turned on and connected to the implant, how many hours a day it's coming off of the implant, which is really useful for our little kiddos who are in school. And it will also give us an indication of what kind of environments the patient is in as well. So all of these things are super helpful for audiologists and for us to have conversations with you as patients about how you're using the device. One question I hear a lot too is, do I really need to wear it all day? And I see things also in cochlear implant experiences and also in other forums that ask about how many hours do I really need to wear it? Can I just start off wearing it an hour here, an hour there? If you're my patient, I will tell you from day one, you need to wear it more than 10 hours a day. I believe very much in the research that my colleagues in the field have done. And there's several great research studies that have looked at this. And what they found is that if you want, as a patient, if you want to have an option for performing the best you can with your implant, this is one thing you can control. You can wear the device more than 10 hours a day, and you're doing your part. If you're wearing it less than 10 hours a day, you will not have as good performance with speech understanding. And it's okay if you don't want to wear it 10 hours a day. It is totally up to you. But I always phrase it to my patients, this is something that you can control, okay? Now, what it does not mean is if you wear it more than 10 hours a day that you're going to, understand speech all the time. It just means you're giving yourself the best chance to understand speech as well as possible. Even from the very beginning, I recommend that you follow this recommendation of greater than 10 hours a day from day one, okay? Another thing that we look at, which is very important, is setting upper and lower stimulation levels. So the upper stimulation levels are the maximum levels of loudness that the device is going to be stimulating at. The lower stimulation levels are the softest levels that it's going to be stimulating at. This is a screenshot from all three companies. You would think that our cochlear implant companies would work together to make things a little more streamlined, and that's not necessarily the case. So for Advanced Bionics, setting these levels are different than for Cochlear, and that's different than Med-El. Hopefully you have an audiologist who's well-trained in the software that you're using for your device, and they should know how to appropriately set these upper and lower stimulation levels. On the first day, on initial activation day, sometimes we don't spend as much time being extremely nitpicky about setting these levels. And the reason is most of the time patients and parents are pretty overwhelmed coming into that appointment. Heightened stress levels can cause you to not set these levels appropriately for yourself, okay? The other thing is if you have any ringing in your ears, any kind of residual noises in your ears, it can make it hard for you to set these levels on the first day as well. The goal is to give you access to sound the first day, and then by the second appointment to try and fine tune it as much as possible. These here at the top, just so you can see if you start looking at your own programming with your audiologist, are the upper stimulation levels. Here are the lower stimulation levels. So how do you set these? Now for children and adults, it's going to be relatively different. But for upper levels, really what we're seeing now is the research in our field is suggesting that using something called an electrically evoked stapedial reflex threshold test, that's a lot, is the best way to measure upper stimulation levels. So your clinic, you may have gone in before and you can see the head over here. So you have one side of your head is connected to the cochlear implant and then connected to the computer. And then your audiologist may have this other machine that they're using where they put something else into your other ear, or maybe the ear that has the implant. And you feel a constant pressure the whole time that they're doing this measurement. What this measurement is doing is it's using your actual physical auditory system, and it's helping set these stimulation levels without you having to tell the audiologist anything. So it's an objective way of setting these levels. This was actually, University of Miami is one of the first places to use this type of technology many years ago. And there's been a lot of research since then that has shown that this is a very consistent way of setting those upper stimulation levels. We try to use it as much as possible for adults, of course, but then for children, sometimes, as you can imagine, getting a child to sit very still to run this test, which can take 5 to 10 minutes. Sometimes that's very difficult. So we'll use babysitters, iPads, or we'll use other people in the clinic to come in and try and keep the child quiet so that we can do this, this way of testing. Subjectively, if your audiologist may not have the tools in their clinic to use the ESRT testing, but subjectively what they may ask you to do is they may say, I want you to raise your hand when you hear the beep, and when it gets loud, you know, say it gets to a level of 10 out of 10, which is very, very loud, and you want to take it off your head, raise your hand. Okay, and they may ask you to rate if one sound is as loud as the other sound, or if they sound like 2 notes on a piano. So there's lots of different ways that we can use you and use your auditory system to set these stimulation levels. For the lower stimulation levels, this is more like a traditional hearing test. So for adults, we are typically saying, raise your hand when you hear the beep. It's getting softer, 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 softer. And then finally, you stop raising your hand because you don't hear the beep anymore. Where this is tricky is if you do have that tinnitus or the ringing in your ears, you may still be raising your hand because you're hearing the ringing in your ears. So you always need to let your audiologist know if you have that ringing in your ears, because it can help us try to come up with a different way of testing you. For children, this is often very difficult to do. So especially for little babies, we have some other methods of trying to set these lower levels from the start. Another way we can do this with adults or even older children is asking you to count the number of beeps that you're hearing. So this just makes it a little more fun. For kids, I might say clap for the number of beeps. So they might say 1, 2, 3, right? Or maybe they'll give me a high five. If it's a baby, again, of course, you can't do it that way. But I could do a whole other talk just on activation for little ones, and it would be quite different just because there's so many different tools that we have to employ with working with small children. We also are going to look at program settings. So sometimes on the first day, the activation day, like I said, we're just trying to get you access to sound. So you may not have a lot of different types of programs, meaning one for the car, one for every day, one for a group, one for, sorry, I think someone's trying to call me. Let me turn this off. One for, riding your bike on the way home, or maybe one for the daycare. The first day, you may find that your audiologist strictly gives you a couple of settings that are progressively louder. And then you may have an audiologist who doesn't give you very many of those settings. It's all going to depend on how that initial activation appointment went and how much you were able to hear on the first day. But when you come back, we have tons of tools for trying to give you different settings for different conditions of your life that you may be in. Also on the first day, many times we will not put you in the sound booth. Many of you have very little hearing to preserve before we did the surgery, meaning you may have had a little bit of hearing that you could hear some with your hearing aids, but it wasn't enough hearing that we would be needing to, use a specific device after surgery. However, there are some patients who have really, really, really good low pitch hearing before surgery. And so we may then, in that situation, be putting them in the sound booth and doing a hearing test to see how much hearing they have left. After your initial activation, typically when you come back to see the audiologist, they'll put you in the sound booth routinely to see how much hearing you have with your cochlear implant, and also to test you with some words and sentences so we can see if you're benefiting from your device. This is just an example of what some of those screenshots from your visit may look like when we are doing the verification in the sound booth. One thing on the first day, on activation day, I like to go over with patients and their families is just a reminder about the typical cochlear implant user performance. And this is in no way to try to discourage families or discourage patients, but it's trying to set a realistic tone for the journey of a cochlear implant user. This is a great picture from an article of two of my favorite researchers in the field, Dr. Dorman and Dr. Gifford. And this article talks about speech understanding in complex listening environments. And it talks about normal hearing listeners compared to cochlear implant users. I've actually used this specific slide when counseling a cochlear implant user's husband on why they should not expect their wife to be able to understand 100% of words and sentences with the cochlear implant. And it really made a significant difference. So here you can see the gray is the cochlear implant user. The white is a normal hearing listener, okay? And so this is percentage correct, so 0 to 100. So this is sentences in quiet. So if I, as a normal hearing listener, listen to sentences in quiet in the sound booth, I'm gonna probably get close to 100% when I do that test. However, someone with a cochlear implant, you can see that the range is from, it can go up as high as about 95%, but the average, which is where this bar stops, is around 80%. Okay, so even in a quiet situation, a cochlear implant user is not going to always understand 100%. When there's a little bit of noise in the background, you can see that that drops off. So this is plus 10. It means that the person talking is speaking 10 decibels louder than than the noise that they're trying to talk over. So there's still quite a bit of noise in the background. It's almost kind of like sitting in a room that has a loud air conditioner, okay? So you can see that that cochlear implant user, the performance with visual cues taken away and only listening to the device goes down to about 55%. But for a normal hearing listener, it stays up to 100%. And then plus 5 decibels is when the speech is only 5 decibels louder than the noise. So the noise is turned up more. And here you can see that the cochlear implant user performance goes down. The reason I put this in here is because the reality is cochlear implant users are in noise all the time. And remember that first slide I said about one of the main goals is to understand better in speech and in noise. And so we have to really look at realistic expectations and also counseling and limitations of the cochlear implant when we talk about this expectation. And programming the device on initial activation or even at follow-up, there's only so much the audiologist can do to make this better. But I've got some good news. There's a lot of things that you as the patient can do to make this better. So one thing I like to recommend my patients get a sound level meter app. And here it's called the NEOSH sound level meter. This is an app where you can just take it out on your phone, you press it, and it all of a sudden starts recording how loud the environment is. So normal conversational speech is around 65 decibels. Here, I was at my hairdresser earlier this week getting a haircut, and I was just sitting in the waiting area for her to call me. It was 84 decibels in there. That means the noise is 20 decibels louder than the speech, okay? So remember back here, this plus 10 and plus 5, this is when the speech is louder than the noise. So imagine how difficult that is for a cochlear implant user unless you're making use of as many of the tools that the companies give you as you can, okay? So this kind of brings us to the external devices, which I think our moderators can probably speak to. There's been a huge evolution of the external devices. And every time the company comes out with new devices, the point of the new device really is to try to help you understand speech better. And there's been a lot of good literature that's been written to show that patients actually do perform a little better each time they upgrade their technology. And it's because the microphones are a little clearer, they're more discreet, they're picking up sound a little bit better. But also we have more ways of programming or processing, I guess not programming, but the sound processing for the cochlear implant is improving as well. And anytime there's an update like that, we get a software update from the company. And when you come in, your device is updated with all of that software update as well. As most of you know, you get a ton of accessories to choose from or that just come included in your bags on that initial activation appointment. Almost too much, of course, to do on initial activation, but all of these accessories are going to help you overcome a lot of that difficulty in noise. I strongly, strongly recommend using as many of these accessories as possible. Many patients will say, oh, it's just too much, or, you know, I just don't think that it's going to be helpful. The truth of the matter is, it is going to be helpful. And if we get you to learn how to use it appropriately, I think you will see a big improvement in your speech understanding and noise. One thing that we try to do at our clinic at a bare minimum is go ahead and get the app set up on your phone the first day at initial activation. But this is something that you could even do before you get to the appointment, is go ahead and load it on your phone. Sometimes people have gotten new phones, or maybe they need a software update. And because that may take quite a bit of time, you know, it may not be an allowable amount of time for you to do this in the initial activation. So be as prepared as possible. Another thing that we may try to do in the initial activation is a bimodal hearing system connection. So for patients who have a hearing aid on one ear and an implant on the other, now the companies have devices that can help talk to each other and work together, especially for those noisy conditions as well. We always like to see devices on each ear. So even if you don't have 2 cochlear implants, there's a lot of advantage to having a hearing aid on your non-implanted ear, because you still are able to pick up oftentimes some low frequency sounds that can help make the sound quality of your cochlear implant even better. This can take extra time in your appointment as well. Be patient with your audiologist. Many of us have been working with cochlear implants our whole careers, and so getting on the train of working with an implant and a hearing aid in the same appointment, it's still something I think many of us are trying to manage the best we can and in the most efficient time manner. But we do want to make sure that you have access to both of these devices on the first day, on initial activation day. A few of you may have enough hearing in the low pitches that you're able to use something called an acoustic and electric device, EAS or hybrid. This kind of device uses an implant and a hearing aid combined device on the same ear. And again, this requires a little bit of extra time in the initial activation appointment as well. So it may be that your audiologist is manipulating each of those settings, trying to get them to sound comfortable for you. And remember, that's really the goal of the first day, that you hear a little better, that it's comfortable, and then knowing that the speech understanding will likely improve with time. During initial activation, we really try to promote the online review of accessories, of activation basics. This is just an example. Med-El now has something called Med-El Mondays, and you can sign up for this if you have their device. It's free, and it's a virtual Zoom meeting where they will go over all the basics of your technology. They'll review how to put the battery on. They'll review how to change the cable. They'll review the app. And it's a nice way for you to do some homework on your own without relying on the audiologist for every bit of your information. We are more than happy to help as much as possible when you're in our office. But there's so many patients, right? We all have so many patients that we're trying to get access to this technology. Oftentimes, if you wait for us to get back to you via email or with a phone call, it may be a frustrating experience for you. So the companies, all 3 of them, have invested in customer service support and consumer relations support so that you can go straight to your company that you've chosen and get all of the follow-up information that you need to make you successful with this implant. The companies, all 3, have invested in online videos. They are amazing. They're through YouTube, and they usually have captioning. They're very simple, like assemble and turn on your processor, how to remove and attach the battery. And then they can be more, a little more complex, how to use your connectivity options. These are great resources. Even me as an audiologist, I still use these once in a while when patients have questions. Meet with your cochlear implant rep. Here's an example from Cochlear. You can actually go online and find your rep, and you can make an appointment. They'll spend an hour with you just making sure your TV streamer gets set up at home, for example. This is not something that I necessarily, as an audiologist, am able to do with my patients. We don't have the time, unfortunately, to be able to offer this service, but the companies do, and they want you to use it. And then start your cochlear implant therapy. This is on day 1 as well. I have a wonderful trainee right now. He is an audiologist who's learning more about cochlear implants. And he actually spends just a few minutes of getting this set up on patients' apps on their phone and helping them kind of walk through how to do it so that it's not so scary and overwhelming when they're at home. And then remember, I was kind of went through that whole list of what we do at the initial activation. One of the last things we do is review the appointment schedule with you. ACI Alliance has a wonderful handout about this whole process. For the University of Miami, and I believe Vanderbilt is doing this as well, we have actually reduced our follow-up appointments to initial activation, 1 month post-activation, 6 months post-activation, 1 year post-activation, and then as needed. The reason that there are shorter number of appointments, less number of appointments than more, is because, again, the research doesn't support coming in over and over to have your device programmed. The levels of your mapping, those stimulation levels, the upper levels and the lower levels, they don't significantly change after about the 3 to 6 month appointment. And so really after that appointment, we're doing very little programming changes, and a lot of it is more counseling. And we can certainly do that with you as audiologists, but the companies can also do that with you too, and specifically for your device. And so what should you expect after that initial activation? Kind of, the same thing, except you're going to really have a lot more discussion with your audiologist every time you come back. Some of the things that you can do to help your audiologist and to help navigate those appointments: come to the appointments prepared to discuss how you're hearing and performing. Be honest. It doesn't hurt my feelings or my colleagues' feelings to know that something's not going right. We want to try to help you fix it. Give concrete examples. Keep a hearing journal. Remember to wear your device consistently. If I do plug your device up and I see that you're only wearing it an hour a day, and your complaint is that you're not hearing and understanding well, we'll probably not do any programming that day. It will probably be more conversation about why are you not wearing it more than 1 hour a day. Make sure you're doing your listening therapy. If you're not doing your therapy at home on your own, you're not facilitating your own progress, right? So wearing your device every day, 10 hours or more a day, and then doing your daily listening therapy are two things that you can control about this journey. Make sure your equipment's functioning well. Use those videos if you have a question about something not functioning well. And then remember, while I love my audiology friends and I think that we do a really good job, we are not magicians. And I really do love that you guys entrust so much faith in us and think that we are magicians, but unfortunately, we have limitations to what all we can change in the programming. The other thing we are not is an Apple employee. And so I put that up here because, I want to spend my time with you about how you're using your device and how we can best make any small changes to get you happier or more satisfied. But make sure that your phone is working when you come in, that your app is working. If there's a problem with your phone, make sure you go to Apple about that or to your Cochlear implant company. They can help walk you through those steps. And, what do we think is going to happen in the future? I think you guys are going to have more control in the future over your programming, and you will be able to assist us a little more, maybe even from the comfort of your own home, which is something that is a hot topic right now. And so I'll be anxious to see how that goes in the future. And then just remember that it's small steps every day, right? This whole journey for a cochlear implant, it is a marathon. It is not a sprint. So on your first day, on that initial activation day, if you are not happy, if you're disappointed that day, just remember that this is a long journey to getting you understanding and hearing better. Use your friends in the cochlear implant world on forums, on chats. The guy I saw today who was posting about, he was very upset, with how it sounded on the first day. I saw all of these amazing cheerleader posts that were coming in one by one, making sure that he knew that this is a great process and that things will get better. I want to thank you all for letting me be here today. I also want to thank my team. We're only as good as the people that we surround ourselves with, in my opinion. I'm very fortunate to have this amazing group of individuals at the University of Miami who constantly challenge me to be a better audiologist. And I hope that you were able to take away at least one piece of information today that will help you with the initial activation process. And please email me directly if you have any questions. I'm always happy to speak at any of your cochlear implant support groups that you may have as well. And so with that, I'll go ahead and take questions if there are any. And I was going to look and see if there were any in a chat.
There is one from a Michael Smith. He says, I'm a CI mentor, 14 years. Can I share the average CI user graph that was just shown with others?
Yes. And you know what, Michael, what I'm going to do is actually, I'm going to go back really quick. Let's see. Whoops. Am I still sharing? I'm going to stop sharing for just 1 second and let me pull up the slide on my end so I can see it. And what I'm going to do is I'm going to put the link to that picture in the chat so that you can use it. It is from a well, I don't know if I'm going to be able to do that. I can have the Cochlear Implant American Cochlear Implant Alliance. They can actually send it out to you. I can do that.
Yeah, this is Nicole with the ACI Alliance. Michael, if you want to drop me a quick email, or my email address is inweston, WESTIN, @acialliance.org. And then Meredith can send it to me, and then I will send it out to you.
Any other questions?
I have one. It might be a little bit off topic. So many times on those Facebook pages, somebody will come and say, I just came back from mapping and they tested me and I got scored 95% in quiet in this and this and that. And I find, not so much for me as a veteran, but I find that a lot of the new people are like really discouraged. Can you talk to that, I guess, is what I'm saying.
You know, this is a great question, Connie. And one of my colleagues from Charleston, South Carolina, where I used to work, Dr. McCracken, he's doing a lot of research right now looking at those scores that we get from the sound booth, which, you know, are not realistic, right? And comparing that to how satisfied patients really are with their cochlear implant and how effective the cochlear implant has been for improving their quality of life. And what he's finding is that the scores that we're seeing in the sound booth don't necessarily correlate with what patients feel about their experience. And so we're trying to get a little bit more away from looking at the scores as meaning that that's a progress or that it's a success. And really the success should be whether or not the patient feels that the cochlear implant has provided them with a better opportunity for hearing and engaging in the outside world than before they had the implant. And the numbers that we get from those tests really historically have been more used for research purposes, and it's not a great comparison of how a patient, so I mean, it's nice if you see 90%, but you know, you get frustrated probably because you're like, I don't understand 90%. And so thinking about using something like that sound level meter that I mentioned, you know, looking at all the situations you're in and pulling out that app and saying, okay, this situation, the level says it's 85 decibels. I'm going to write that down. And in this situation, it says it's 70 decibels. Oh, you know what? I actually do hear and understand better in that situation than the other one. Okay, now this is making a little more sense, you know? So I try to just give as many tools as possible so that you guys can apply it to your everyday life, because the sound booth is not your everyday life. Yeah, I see you not shaking your head, Connie.
Did you say for that meter app that speech is normally 60? Is that what you said? Okay.
Yes, and I'll go back to that just so you can see the picture of the app too. Yeah. So there's a lot of different sound level meter apps that are out there. I just love this one. I use it for myself all the time. It helps me counsel my patients better too. But so normal conversational level is usually around 60 to 65 decibels. And that's the level that we're testing you at in the sound booth. And so even in the sound booth, the noise is never getting above 55 decibels. Okay. So if you were with me in my hair appointment the other day, Connie, you probably would have really struggled to understand what I'm saying, because I couldn't even understand some of the things people were saying. My hairdresser was, trying to cut my hair. It was really loud. And then she also had the hair dryer going. She kept having to cut off the hair dryer to hear me answer her, right? So that's all reality for a normal hearing person. But then if you with your cochlear implants are sitting there trying to converse with her, it's going to be almost impossible in that situation if you're not seeing her lips as well.
Yeah.
But this is a great tool, and it will be fun for you to start to write it down. Like, okay, here's what my hairdresser is. Here's what the grocery store is. Here's what Zumba class is. Here's what church is. And then it gives you a perspective of, you know what, maybe I need to use my accessory a little more in this situation than that one.
And
yeah.
I'm sorry, nobody else is.
That's okay, Connie.
You said you do, of course, this is so totally different than 17 years ago, but you do an activation and they come back in a month. Can you speak to, are there certain situations where they need to call you and say, I need to come sooner?
Yeah, so I usually tell patients on the first day, well, here's my spiel. I say the first day is going to be the worst day that you hear with this implant, and you're going to wish you hadn't done it when we turn it on because it's going to sound so bad. And usually they're like, oh, okay. And then they're not quite as upset because they are prepped with that. But for the first month, I tell them your goal is to wear it 10 hours a day, to do your therapy every day. And then by the time you come see me, your brain is going to be ready for an adjustment. Now, historically, patients will want to come in if something is causing them a lot of pain. If it's way too loud and causing them pain, that's an appropriate time to come in. Or if their device isn't functioning well. But now we have the companies are able to work with you on the device not functioning well and get things taken care of without you having to come in. Here in Miami, one of the biggest barriers for our patients getting into the appointments is, we don't have a lot of appointments available tomorrow or the next week, and that's how most clinics are. But also, it's time away from work, time away from family, expense with gasoline. I mean, it's not an easy process anymore just to pop in for something. Most problems can be dealt with without you having to come in. But if it is something that it's pain, the magnet's too tight, you're having dizziness, your face is moving with the stimulation, anything like that, that would be a reason medically to come in. Yes.
Well, that's what you do at your center in Miami, but I live in New York and I go to the NYU Cochlear Implant Center. And they have a totally different protocol. You come the first day you're activated, and she gives you a few little levels of sounds, and you keep changing the program up to increase it. The second day you come in, you do the same thing, and then you come back a week later, and then she first gives you a program. And then you come back 2 weeks after that, then 1 month, then 3 months, then the 6 month. So it's, I feel like you have a lot more support that way.
Yeah. And I think, Eileen, that's a good point. Every clinic is a little bit different. Our goal, of course, is to make sure you're hearing the best you can. And by using some of the new techniques like that ESRT, where the machine is going, something's in both ears at the same time. If you're setting levels that way, then typically you don't need to be seen as often because those levels aren't going to change, and the research really supports it. And in the beginning, even doing all of those appointments in the beginning, we used to do those too. And I did those when I was in Charleston. And we started seeing that they weren't as necessary for everyone. Now, some patients, we still will have them come in a little more often. But for the most 80% of the time, most patients, this newer appointment schedule is appropriate. The other thing that we have to really think about from our side of things, from the clinic side of things, is we want to make sure that we have appointments available for new patients to get in to see so that they can get access to cochlear implants. And one thing we've learned in the field is if we continue to see patients who have been implanted, if we continue to see them more than they need to be seen, then we're almost clogging up the system. So new patients who are having trouble hearing with their hearing aids, they're not able to get access to cochlear implants effectively. And so there's like a fine give and take on that. And Eileen, I think we're trying to figure that out with our patients too. But I know your group very well at NYU, and we've talked about the differences with them and with us too. So it definitely is not a one size fits all. And I think you have to be very comfortable with the clinic you're at.
Anyone
Thank
else
you,
have
Meredith. This is
questions?
Nicole again with the ACI Alliance. We have reached 1 o'clock. So our webinar is over, but thank you to Meredith and our moderators, Eileen and Connie. And keep an eye out for this being posted on our website. And please take an opportunity to check out our website for additional Tuesday talks. Thank you all again.
Thank you.
Thank you, Eileen and Connie at ACIA.
Welcome.